Hi there, I'm Dr. Sarah, a naturopathic doctor specializing in holistic dermatology. If you're new to my channel, I share my own personal journey with healing chronic eczema, as well as focus on holistic health, dermatology, skincare, nutrition, and more. In today's video, we're talking about eczema versus psoriasis. What are the key differences between the two and how to tell them apart? Quick disclaimer, this video is for educational and informational purposes only and should not be used to diagnose or treat disease. Please don't self-diagnose. If symptoms arise, see your doctor, dermatologist, or healthcare provider. So eczema is actually an umbrella term for different skin rashes, as there are several different varieties of eczema. And so in this video, when I'm referring to eczema, I'm referring to that as atopic dermatitis. First, for a definition of these skin diseases, atopic dermatitis is an inflammatory skin condition characterized by pruritus or itchiness, dry skin, flaking, and erythema due to an impaired barrier function of the skin. And then psoriasis is also an inflammatory skin condition, but this involves an abnormal activation of the immune system and hyperproliferation of your keratinocytes in the epidermis, and this results in a thick, raised, roughened skin, scaling, and plaques. So, eczema and psoriasis do have some similarities. They are both inflammatory skin conditions that have some sort of component of the immune system activated, and they can both be affected by diet and food triggers, definitely impacted by stress and like quality of sleep. As well, they both are affected by your gut health. So, how can we tell them apart? First off is the rash. So the rash type definitely looks different. And in eczema, the type of rash that you get, it's going to have dry skin and flaking. Sometimes it's red and erythematic. The skin is very dry and you can get cracking in the skin. There can also be small little vesicles that form in the skin with eczema or water blisters, and these can ooze just a clear liquid, and then this can kind of dry and crust over. And eczema presents a little differently in different skin tones. So in lighter skin tones, you're going to see more of that redness and erythema. And you can also get hypopigmentation, which is a little bit loss of the pigmentation of your skin, so that can look kind of like white patches. In darker skin tones, the eczema flare-ups tend to look darker brown, purple, or ashen gray in color. And in darker skin tones, you can also have small bumps develop on the torso, arms, and legs. And this is called papular eczema. And sometimes you can also have little bumps develop around the hair follicles, resembling goosebumps, and this is known as follicular accentuation. And then for the rash type in psoriasis, you have those thicker plaques because you have that proliferation of your skin cells, and you can get those thickened layers of skin that are called plaques and have scaling. And so in lighter skin tones, what this looks like is an erythematous or red base, and then you have the white silvery plaques. And then in darker skin tones, you're still going to get that thickened layer of skin, but it's going to be more violet in color, sometimes dark brown, or kind of that gray scale. All right, another key difference between eczema and psoriasis is the borders. So in eczema, you have poorly defined borders, and that just means that the border of the skin that has eczema versus normal skin you can't clearly distinguish, like you couldn't draw a circle or a line around it. And that's very characteristic of eczema. It kind of just sort of blends in, versus in psoriasis, the borders are very well demarcated, meaning you can easily distinguish the skin that has psoriasis versus the normal skin right next to it. If you're finding this video helpful so far, then please give it a like, as it really supports my channel and it helps get it out to more people and makes it possible for me to do more videos. Alright, next difference is the presentation of these skin conditions. So, in eczema, it's going to present typically on the flexural surfaces. So that is going to be the inside of the elbow, the antecubital fossa, and then it's going to be behind the knee in the popliteal fossa. And those are what we call the flexural surfaces, versus in psoriasis, it's on the extensor surfaces. So that is going to be the back of the elbows and then the fronts of the knees. You're also in psoriasis, same thing with having it on the extensor surfaces, so it's going to be more often on the top part of the arm. And then in eczema, it's going to be more on the flexural side. Not always, it can obviously overlap, but that is just what we typically see. It's a typical presentation. So in eczema, you can also, a lot of people get it around the neck. I definitely had it around my neck when I had eczema, and you can also get it behind the ears. And then kind of around like areas of skin folds, that is common for eczema. It's more prone to sweating and heat, and that can kind of trigger a little eczema flare. And then on infants, we usually see eczema beginning on the cheeks and the face. And then also with eczema, you can get that on the hands. You can get it on either side, but when you have it on the palms of the hands and the soles of the feet, that is typically called dyshydrotic eczema, and that begins with little blisters on the skin, and they are extremely itchy, and then you have these little water blisters all over, and then they kind of can ooze out, and then they kind of dry over, and you kind of get this little cycle. And then with psoriasis, oftentimes we see that on the scalp, on the trunk, more so in the gluteal region, and then, of course, arms and legs. And when we do see it on the arms and legs specifically, we see usually more of a symmetrical presentation. So if you have it on one kind of side of the elbow, a lot of times you'll see it on the other in a sort of symmetrical pattern. Same thing with on the legs. And then lastly, we can see eczema in the nails. You can get pitting symptoms, and that's kind of what that looks like. Another key symptom difference is in the type of itch. So with eczema, it is typically very itchy, especially if you're having a flare-up or more of a moderate or severe type of eczema. Especially at night, itching can get worse, and so much so that it can disrupt your sleep, cause you to have poor sleep, or you can even have itching in your sleep without you like fully consciously realizing it. And the type of itch and scratch is almost insatiable, and you just itch until it burns, basically, in some patients. Psoriasis can be itchy as well, but not to the same extent, but you still have like this sort of dryness and the flaky skin, so that can sometimes make it itchy, but it definitely is a little bit different of a feel. Now let's move on to the causes and etiology of these skin conditions. So with eczema, like I said, there is a disruption in your skin barrier, and oftentimes this is impacted by a decrease in filaggrin, which is an important protein in your skin. And so with this, you're having increased water loss from the skin, so that is causing the dryness, and that is leading to the flaking and the itching and the scratching. So with that impaired skin barrier function in eczema, your skin can be very sensitive. So it can be sensitive to just chemicals and fragrances and products. It's also sensitive to like different materials. Wood can be really irritating and aggravating, as well as even like synthetic materials like polyester. It's also sensitive to like temperature changes and sweating. So you have that key aspect of it where the barrier is just more sensitive. We can also see higher levels of immunoglobulin IgE. So IgE is that allergic response, and it causes histamine and is related to food allergies and food sensitivities. So oftentimes those can be triggering the eczema. With that is related to the atopic triad. So you can also have hay fever and asthma, and just kind of in general is like that hypersensitive type of picture, having like those environmental allergies, possibly some food allergies, and kind of just more of an inflammatory state in response. And then with psoriasis, we also have that autoimmune factor. You have a large number of activated T cells. You have more inflammatory cytokines like TNF alpha and interleukins, interleukin 17 and 23. So that's causing inflammation and causing those symptoms as well. And then with psoriasis, since it is autoimmune, that can put you at a greater risk for other autoimmune conditions. And what we also see with arthritis is a lot of joint involvement. So you can have psoriatic arthritis, where you're having inflammation of your joints as well. So those are some of the key differences between eczema and psoriasis.